Coming up, though, we're going to hear the other side of this, how this could be a problem for people with addictions. That's next. Welcome back. I'm Simi, Sara. We are talking about the drug Oxycontin. It is an especially effective painkiller, also known to cause addiction problems. And now the patent is up in a couple of weeks, which means you could see generic formulations of this. So is this going to cause us more problems? Well, to talk about the more addictive aspects of this particular drug, Tibor Palatinus joins us now, a drug prevention specialist with the Narconon Vancouver Society. Hi, Tibor.
Hi, Simi. Nice to be back on the show.
Well, thanks for being here. Tell me, what is it about Oxycontin?
Well, Oxy is also known as hillbilly heroin. It's so close in its chemical structure to heroin that only scientists can detect the difference. So it's an extremely potentially addictive drug when even given a small opportunity of abuse or a small opportunity where things are not very well controlled, let's say in a hospital setting or in a very clinical environment.
Right. So when you hear then that the patent's going to be up in a couple of weeks and we could be seeing the market, covered with some perhaps generic versions of this, does that concern you?
Completely. It's kind of a crazy thing to even consider because lawmakers across Canada have said Oxycontin is dangerous. They've said it shouldn't be even used in the country. I mean, they basically said no more Oxycontin in Canada. Now, just because a patent is up and you can get it for cheaper under more brands, we want to make it available. I mean, don't you think that's a little crazy?
And yet, have we heard what the federal government plans to do about this?
No, I have not. I'm hoping that shows like your wonderful show and other radio shows and TV will make the point very clearly that this is simply a backdoor to an already existing and safe law, which is keeping Oxycontin out of Canada, and we should keep this door closed for generic brands.
Right, but Tibor, do you actually think that does the general public know about this? I mean, do they know enough to say this is something that I should be worried about?
Well, that's why we're on the show right now. This is why this is the purpose of the media, is to make this information known. Because let's say Oxycontin comes out under 5 or 10 other generic names. The public doesn't know. They have no clue. Now it's called feel better drug, and with this sort of situation, again, you have a naive public, who could become addicted to this very powerful addictive drug.
How big of a problem is this in other areas?
Well, here's the thing. In Ontario alone, there was a 5 times increase in the use of methadone-assisted addictions treatment after Oxycontin came to market in Ontario. They have now like 36,000 people who are on the methadone maintenance program, and this was jacked up significantly by the release of Oxycontin and the supposed benefits of Oxycontin. So, I'm not suggesting whether it's a good drug or a bad drug. I'm simply saying it's a very addictive drug, and it has not proven to be safely used in Canada. In Canada, we are the number one country in the world to prescribe what's called oxycodone, which is basically what Oxycontin is, and we have the second highest overdose death in the world. So, this is not a small problem. It's a big problem. So, my recommendation...
Yeah, go ahead, sorry.
Well, my recommendation is to force the Canadian population, and specifically universities like McGill, to look at complementary and alternative health solutions which are not potentially dangerous, not causing overdoses, not creating addictions, and force them to actually consider and utilize these wonderful alternative health solutions which the rest of the population of Canada is embracing fully. Yet, possibly, I'm only guessing here that, universities like McGill, who are getting, $153 million a year for funders, doesn't have a profit motive in keeping, drug companies giving them that money for their, medical studies. So, I'm really looking at conflict of interest here.
But what are the parameters for prescribing this for doctors? I mean, it sounds so alarming when you talk about all the statistics that way, but who's prescribing this then? What's it for?
The main purpose of Oxycontin, or the main purported purpose, was for pain situations. So a person who had a recent accident or it came out of, let's say, a shoulder operation or a back operation could be prescribed Oxycontin, okay, at least in the past, no longer in Canada. and they were not being told or warned of the potential addictive natures of Oxycontin. And within months, or in some cases 6 months or a year, they find they've become incredibly addicted. So, this is the way in. Now, the other side of it is that this drug, Oxycontin, and its derivatives, and potentially generic brands, are mostly available on the street. And that is my big concern, is that the movement out into the street. As soon as you open the door to a generic, it will come on the street. The majority in our own downtown east side, you will find more prescription drugs than so-called street drugs in the downtown east side for sale readily.
Well, so, Tibor, we're going to talk more about this. We have to take a quick break, though. Tibor Palatinus is our guest. We're talking about addiction to Oxycontin. More right after this. Tibor Palatinus is our guest, a drug prevention education specialist. And Tibor, we're talking about Oxycontin here, and you're worried about the impact of generic Oxycontin on the street.
Absolutely. And I'm all for, better solutions. I'm not, immune to the idea that, people in pain need, solutions. I'm simply saying that opiate drugs are not a good solution. And if you'd like to talk about that, I'd love to. But, I'm definitely against the generic branding of what has been an outlawed and very dangerous addictive drug in Oxycontin.
But Tibor, given how much concern there is about this drug, aren't we very careful? Aren't there rules about how this gets prescribed? There must be protocols, and it must be not as easy as just be able to get it.
Well, in Canada was touted as the, it has world-class health care, medical care, and so on, and lots of symptoms, or I should say solutions, are apparently put in place. Yet it doesn't change the fact that we're the number one most using or abusing, oxycodone country in the world, per capita. In the world. So what does that say about our careful system? If we haven't been able to do it in the past, I don't predict that we will do it in the future any better. So I'm suggesting an alternative, healthcare where, for example, things like referral pain, emotional pain, mental stress, mental pain are known to generate most of pain situations. In other words, they bring on feelings of uncomfortable or undesirable pain. So dealing with the mental and emotional and stressful pain, otherwise known as referral pain, is far more effective at dealing with a pain issue than simply giving someone drugs, which simply confirms to the patient that they have a problem and it's a physical one. Well, I don't believe so. I believe most of the pain is generated mentally or by stress, and then directing individuals to handle their stress and emotional pain through those solutions, through either counseling or, complementary and alternative health solutions, such as, Qigong, direct counseling, healing touch, chiropractic.
You think some of that would actually substitute for people who have chronic pain problems?
They already are. They already are in place. Where people are getting counseling and direct attention to those things. Old school stuff like Dianetics. The new school stuff like cutting edge psychology is dealing directly with pain sources that are of a mental origin, or at least start those mental or I should say painful processes that are experienced physically.
Tibor, it sounds like you're saying anything but oxy. But listen, thanks very much for your time today.
Thanks so much, Simi. You summed it up perfectly.
Okay, that is Tibor Palatinus, a drug prevention education specialist with Narconon in Vancouver. The discussion being the fact that Oxycontin is, the patent expires in 2 weeks. It could be made now by generic drug makers, and will that cause a problem and more addiction? And already this drug has gotten lots of headlines for that. All right, we've heard from South Surrey residents who say no thanks to a proposed